I'm Dr. Janice Cayley, and I'm a periodontist at Progressive Periodontics and Implant Dentistry. One of the questions that you should be asking as a patient looking for implants are implants right for me? Are they a good option for me? And to that I'll say, if you're missing a tooth, absolutely. You don't want to be without teeth. Teeth need friends, and implants are the best way to make sure that you fill in those gaps, and it gives you the function that you need to make sure that all your teeth are working well together. Well, in determining the difficulty of a case, we look at many different aspects. We're going to look at how many teeth you have present, what the bone quality and level is of the areas that you're missing teeth. That's probably one of the biggest things that we have to assess. Then after that, we're going to be looking at your medical history. Do you have any medical issues that might compromise the success of your implants, such as smoking, diabetes, uncontrolled diabetes? Diabetes in and of itself is not a contraindication for implants, but uncontrolled diabetes will put your implant at risk. So in reality, implants are great. If you do the basics in just making sure that you brush and floss and come to us for your regular checkups, that implant should last you for a great number of years. The good thing about implants, or the bad thing, however you want to think about it, if they're going to fail, they're going to fail very, very early on, usually within the first year. And if they get beyond that first year mark, which 98% of patients normally do, you're pretty much set. And all you need to do is take care of that implant like you do the rest of your teeth. So one of the questions that's really important that you need to ask is where your implant surgeon was trained. Did they do a residency, or did they take a CE? I went to school for an extra 3 years. I studied periodontics after dental school, during which time we were taught how to place implants. We did extensive training with the restorative specialists, prosthodontists, and we would plan cases. So we did a lot of implant training during that 3 years. Planning cases, you have to look at not only the placement of it, but you need to see where the end result is going to be. You want to know where you want to end up so that you can reverse engineer and treatment plan and just plan that case appropriately so that the surgery and the placement of that implant is ideal for the end result, which is the crown. So having the ability to have a prosthodontic partner that I was paired with for a full 3 years, we got to work together, and I got a much, much deeper understanding of the restorative aspect and seeing where and how this prosthodontist wanted this case to finish, and then what I needed to do to make sure that I was setting him or her up for success. If you take a CE course, you're not going to be able to do that in 2 days. This is something that we developed and we were working on over the course of 3 years. The end results of all of that comes out simply a better placed implant. You're happier with the crown, the entire aesthetics and the function, and it looks much more natural in what we are trying to replace. So one of the other questions that's very important to ask is who's going to place your implant? If you come to my practice, I'm going to place your implants. I'm going to do the surgery from beginning to end. And typically, if we're talking about a single tooth, you're looking at about an hour appointment. So it's pretty quick. It's pretty efficient. If it's multiple teeth, it can be a little longer. If it's a full mouth rehab case, you're going to look at being in our office for a few hours, but I'm the surgeon that will be performing all of the procedure from beginning to end. So one question that you might want to ask your implant surgeon is how they handle difficult cases. If you were to ask me, I would say that there is no such thing as a difficult case. It all comes down to training, your ability to treatment plan and diagnose effectively to determine what your outcomes are going to be. Now, with my training for 3 years with a prosthodontist in all my implant cases that I did during my residency, I developed quite the skill set in being able to diagnose and treatment plan effectively. To that, I can also say that I have the ability that when I do see a case, a difficult case, what might be perceived as a difficult case, I can break it down and know that this is where I need to be and this is how I have to get there. In my case, I take all cases in. I do from the simple single crown implants to the more complicated full mouth rehabs. If it is something that I have not encountered, then I will refer to an oral surgeon who I have worked with very closely, but that is a very rare instance. That is not something that happens very often. I usually do all the cases, all difficulty levels within our office. So in terms of difficulty of cases, if, for example, it's determined that you need zygomatic implants, which are implants in your cheekbones to support a upper fixed denture, that's something that I'll likely refer to my oral surgeon friend to take care of. So if you need to have zygomatic implants, it's typically that person that has no bone on the upper and they want to have a complete fixed denture. It's someone that's probably been missing teeth for 30 years in some cases, and they just have lost so much volume of bone that we can't really do anything except go up into the cheekbone.